Well, good morning, everyone. And how are you? Once again, welcome to another live this morning. Hope you're having a great start to your day. We certainly are, and we love to see you come on here this morning. And let me see if I can say hello to you. If I get that list, let's see here. Okay. Hey, guys, we love you dearly. Hold on a minute here. Let me see. As you get your notifications, thanks for coming on. Guess what it is today? It's Q&A Friday. Here we go. I think I'm all right. Let's see if any names come up. I don't know. Okay. No, I don't think I'm seeing it here. No, the names ain't coming up for me here. So we're just going to have to say hello. Okay? I don't know if because I'm linked to this device or I don't have no idea. Okay. Okay, so we're going to go to Q&A. Hello, everyone, as you come on. You know who you are. I'd start a list of the top 100, but I even then might miss some folks. So you know who you are. You know how much we care. And ordinarily, I have another device with me that I can look at the names, but this one must be attached to my phone. So guess what? I can't see it. I can't. You guys can. I can't. Okay. So let's get to the questions. Marilyn starts out today. Okay, so good morning, everyone. Thanks for coming on. It's Q&A Friday, and Marilyn's got a question. It's always good. We love Q&A. We love questions. Would low free T3 and TSH of 5.23, which is high, I know, cause eye twitches all of a sudden? Possibly. Possibly. Your thyroid's out of whack. Hypothyroid, sluggish thyroid. Do you have Hashimoto's? I don't know. I'd have to ask you the question. You say, Marilyn, you're on a strict carnivore diet. Okay. Well, I got no problem with that. You could be, like if the eye twitches are coming, it's possible that you're low in potassium or magnesium, more potassium for me when it comes to eye twitching. So you might add some potassium. Okay? Add some potassium. Add some salt. Make sure you're getting enough salt. And if you're not on magnesium, you should be on magnesium. Okay, those are the things, because magnesium helps your thyroid too. And I hope you're on our thyroid formula because it's very, very good for you. Okay, that's Marilyn. Thanks, Marilyn. Good question. Karen, what supplements work the same as blood thinners? Well, I like that question because I get asked that question a fair amount. And not only that, there's a lot of misinformation when it comes to blood thinners. Because if you listen to people that really don't know anything about supplements, they'll tell you, well, don't be on fish oil if you're on a blood thinner. Don't be on curcumin if you're on a blood thinner. Don't be on this. Don't be on that. Look, here's what I know, okay? The only thing that I would be careful with if you were on a blood thinner, that's something that acts similar to a blood thinner, would be nattokinase. Okay? Nattokinase. Otherwise, to be honest, I'm not too concerned. Listen, I've been around the block a long time. I've watched supplements. I've seen supplements. I'm going to say tens of thousands of people, maybe not that many, but just about, that were on blood thinner. And, they scare the life out of them because they, oh, like omega-3 will thin your blood. No, it doesn't. It doesn't thin your blood. Okay, that's not how it operates. I mean, to some extent, the best blood thinner in the world is water. Water thins your blood, but it doesn't decrease your platelets. Okay, that's what a blood thinner does. It decreases the platelets, the sticky platelets in your blood that stop you from bleeding to death. If you ever cut yourself, you have platelets. And so water thins your blood. What omega-3 does is it lubricates your blood vessels. That's how it operates. It don't thin your blood. Okay? I used to look at blood all the time, and I often tell a patient, you got blood as thick as molasses, because that's because they were dehydrated. Now listen, you go to a pharmacist, and they'll often tell you, you're on a blood thinner, like almost every supplement is out of, they're just being cautious and they really don't know anything about supplements. So anyway, okay? That's how they operate. All right, thank you for the question. Karen, we appreciate it. Joanne, I have psoriasis. Okay. Wondering if a high dose of vitamin D and omega-3 would help. But I do both for sure. Listen, if you have psoriasis, okay, you have autoimmune. If you have autoimmune, you got leaky gut. Fix that too. Okay? Joanne, fix that too. You need to be on probiotics. 100%. Broad spectrum probiotics. Because you got leaky gut. If you got psoriasis, you got leaky gut, plus you have an invasion of the third army. You have a fungal invasion. You have a yeast invasion. Fungus, yeast, call it what you want. The cousin of mold. That got into your bloodstream. It should have never been able to get in there, but with leaky gut, maybe antibiotics in the past. A lot of things can cause leaky gut. The number one is the use of antibiotics. And and when you don't renew, replace with probiotics, that's autoimmune. A fungal infection becomes systemic. Got to fix that. But I love vitamin D. You know that. It's very good, very anti-inflammatory, very good for you. Omega-3, absolutely. I do high DHA. Okay? High DHA is the best of omega-3s. Natasha, how are you? What's the difference between magnesium glycine and magnesium glycinate? I've never been asked that question. Natasha, thanks for asking. Look, they're really the same thing. The glycinate, okay? At our office, we use magnesium citrate or magnesium biglycinate. Bisglycinate. There's an S in there. Biglycinate. Okay? Whenever you see ATE at the end, that's because it's been chelated, meaning it's ready to be absorbed. That's why I like magnesium citrate or magnesium biglycinate. Glycine, magnesium glycine, is the same thing. It just hasn't been chelated yet. Okay? I'm not even sure you can buy magnesium glycine. Okay? I don't think I've ever seen it. But when you see the ATE at the end, Natasha, it's just because it's been chelated and it's ready to be absorbed in your body much better than when it's not chelated. Magnesium chelated is the best. So biglycinate or citrate. Okay, thanks for the question. I appreciate it. Brenda. I answered Brenda last week about leg atherosclerosis. So she's got hardening of the arteries. I don't know if it's in one leg or both, Brenda. You obviously found that out through ultrasound, usually, okay, imaging. And you, okay, how do I dissolve the plaque already there? Well, a couple of things, okay? Like, you don't see so much of this anymore, and even some cardiologists were doing this. I mean, guys that thought outside the box. They got IV therapy of chelation. So I just talked about chelation earlier when I talked about magnesium glycinate and citrate, right? They're chelated, meaning the word chelate means bitten off. Okay? So you can get IV chelation. What they do is they put a substance in there called EDTA. Okay? And that is a chelation substance that is made for, originally was made for heavy metals like mercury, lead, especially lead. After World War II, chelation was developed because the soldiers had lead poisoning and they had to figure out. And so what they did is they took a vinegar-like substance, EDTA, and you know when you put vinegar, you know, to not only clean, but to dissolve. You know how you put vinegar in to dissolve the calcium in a coffee machine, right? You put vinegar or vinegar-like substance, right? Well, that's chelation. That's the word. It's chelating the calcium out of your coffee machine, right? Have you ever done that? Okay. Well, that's what chelation does inside your body. It helps take in the calcium. Atherosclerosis is calcified blood vessels. Okay? And like I said, I've done in the past, in my clinic, chelation therapy, IV. I've done in the past chelation suppositories with EDTA in there, a vinegar-like substance, through suppository to help get rid of calcium in the body, a calcium buildup, especially in the carotid arteries. You could try it on the legs. And nattokinase is a chelator. Okay? I like Navitol because it opens your blood vessels. That's why I told you last week. And you need to lubricate. Open nitric oxide, lubricate omega-3, high DHA. No better lubrication than that. So those are the options. Thank you for the follow-up, Brenda, question. Okay? Vitamin K2, yes, it takes calcium out. Okay, if you want to take a separate vitamin K2 supplement, I got no problem with that. Okay, eat your cheese. There you go. That was Brenda. Elaine, is it safe to use oil of oregano directly into the ear for an earache? If I had a Q-tip on you, I'd show you how to do it, okay? But you got to be very careful, okay? I don't like inserting much into the ears at all Be very careful. Oil of oregano, my word, is strong. But here's what I used to recommend, okay? A little, couple of drops of oregano oil. I love oregano. You guys know that. Oregano oil, okay? On the end of a Q-tip. Don't go in too far. Just barely get it in to the eardrum. Just barely get into the ear canal. Don't go to the drum. And just a little bit there. Okay. I tell you, it's good. You can do that with your sinuses too. Like take oil of oregano, put a little bit of probiotic on it. Put it in the sinus, okay? That's Chinese torture, by the way. Okay, because your sinuses are so sensitive. Put anything up there, and but you don't go too far. You don't have to. Just barely put it in the nostril and sniff it. Okay? Got it? Hey, that side's a little blocked up. I'll do it afterwards. I feel a little bit there. I didn't even notice until I did this. Yeah, that's my right side. Okay. Okay, that's what I recommend. Okay, thank you. Be very careful, Elaine, okay? Anything going in the ear, I'm very careful. Like, when people like, you use the Q-tip, I never like that. To clean out the wax, I don't like that. Okay, that's me. Be very careful. Okay, thank you very much, Elaine. Anna, Dr. Martin, please explain the difference between his own vitamin D and the synthetics one. Well, look, natural vitamin D is the sun, okay? You want to put natural vitamin D in a supplement, like you've seen our vitamin D with K2. How do we make that? Okay, it's natural, and the best form is vitamin D3 that is made when the sun goes through sheep wool. And they take that and they liquefy it. And it's got vitamin D3 from the sun. Okay? Now, better to get in the sun. The best. But when you're supplementing with vitamin D3, make sure, first of all, it's D3, not D2. And the best form is the wool, sheep wool. Okay? Sheep wool. And that's how you do it. Okay? That's the difference, Anna. And I like our vitamin D because it's got K2 in it. Okay? And K2 takes calcium out of blood and puts it where it belongs, into bones. Okay? Thank you, Anna. I appreciate the question. Rafaela, how are you? Okay? I would like to ask Dr. Martin for anything he could advise for acquired angioedema. Please note we need European dosage. Are you watching from Europe? Okay. Hello. I know we have people all over the world. I used to have a radio show. You know what the problem with the radio show was? And I love doing radio. Okay. I did. 20 years I had a radio show. If you were in Europe, good luck. You couldn't listen to it. Okay. Even though we had it syndicated and that, but it was limited. When you have a podcast, not limited, around the world. Beautiful. My son had to explain that to me. He said, Dad, we're not doing radio anymore. We're doing podcasting. Do you understand me? He's the boss. I didn't even know podcasting. I didn't even know what he was talking about. What? What's a podcast? And the rest is history. Okay. Okay, acquired angioedema. That's when you get, it's an autoimmune thing, rare. And I've seen it after cancers. I've seen it. It's an autoimmune. So certain autoimmune disease. Where did I see it? A few times in my office, like with lupus. I've seen angioedema, and it's a real swelling. Trying to think of anything else that I've seen it in. I've seen it after a cancer, certain cancers, blood cancers usually. Severe swelling that you really see in the face, lips. What would I recommend? Okay. High DHA, excellent. I check, and you're asking for European numbers. Well, I'm going to give you European numbers because I give it to you in grams or milligrams. I like about 3 grams up to 6 grams a day of DHA. Now, that's not easy to get unless you're taking our capsules, but around 6 grams, try that. Vitamin D, I would be at about 10,000 international units a day. What else would I do? I like Navitol. Navitol's pine bark extract. I would take about 4,000 milligrams a day, or 4 grams. Okay? That's what I would do. Thanks for the question, and we appreciate you. And let me ask you, Rafaela, where are you in Europe? Okay, I'd like to know. Thanks for watching. We love you. We love you. Thanks for coming on all over the world. I know we got people in Australia. We got people all over the place. All around the world. Thank you. Cynthia, okay, she's got a long question, but she's saying she really suffers bowel issues, okay? And she was taking magnesium citrate, it helped, and a product called Floralax. I remember Floralax, I've seen it. Look, Cynthia, before, I'm not going to answer maybe directly what you're asking me here, okay? When I see someone, okay, this is moi, okay? This is just my experience. People that got just a very, very sluggish bowel, here's me. One, I always look to the thyroid. Was the thyroid sluggish? And even though your numbers might not say that, because numbers, yeah, it's not that I dismiss numbers, thyroid numbers, but it don't tell the whole story. I'm a big guy on how's your metabolism? How are you feeling? People that have chronic constipation, usually, this is me again, I find they eat way too much fiber. They're fiber crazy because they believe that without fiber, they won't go to the bathroom. Dr. Martin, look, I believe when you have chronic constipation, it's because usually it's the opposite. You're bulking up that stool way too much. What I would do the reset for 30 days. Eggs, meat, and cheese. Drink a lot of water. The best fiber in the world is not fiber, it's coffee. Drink coffee, okay? Because coffee, you ever heard of a coffee enema? Coffee's good for you, and coffee is the best fiber in the world. eat steak. Okay? I'm a guy to debulk your stool. And again, like I said, check the thyroid because that can be sluggish, okay? So if you're having constant problems with the bowel and, sometimes, look, I don't want to be negative, but sometimes you're overlooking things, and that's possible. Give me more detail on your history, and, it's not normal for anyone to have to take a supplement to go to the bathroom. It's 100% far from normal. Now, I realize some people do that. Okay? You can go Metamucil, and not that Metamucil is natural because I don't like it, but people, they get focused in, unless, look, you're in a lot of discomfort, that's different. But there was a lot of patients used to come in, just let me ramble for a minute. Patients used to come in and go, Dr. Martin, I'm constipated. I said, okay, how often are you going to the bathroom? Every second day. I said, well, are you severely bloated? No, but I should be going every day. I said, who told you that? Don't compare yourself to your next door neighbor. Like some people, like everybody's different. And when you throw out a rule of thumb, you have no idea how many millions of times over the years, I'm exaggerating, but lots of times, that people, they really weren't constipated. They thought they were constipated. And then they were on all these kind of fiber supplements and I got to have my oatmeal, I got to have this. And they were over fiber. Like I always said, fiber is overrated. Okay? Fiber is overrated. Water is better. Coffee is better. But if you still are and you really are constipated, you know what? Again, I like to lubricate. Even the bowel, I like omega-3. You have no idea how much I love omega-3 DHA. Lubricates the bowel. And probiotics. Those strains of bacteria that are so good for you, especially the acidophilus. Bacteria. Regenerate, renew. Renew, regenerate. Replenish the bacteria. Okay, thank you for the question. Cynthia, we love you dearly. Rita, do you have insight on smartwatches? Are they bad for you? Look, no. Rita, look. I like the question because I want to pontificate for a minute. Okay? Maybe. But Rita, you'd have to leave the planet to be completely safe in this day and age. You know I talk about that all the time. Okay? Your address ends with not what postal code, what planet are you on? Planet Earth? Oh, you're going to be surrounded by chemicals. You live in China? Surrounded. You live in Canada? Surrounded. You live in the US of A? Surrounded by plastic, microplastics, waves, Wi-Fi. I got Wi-Fi right here. If you listen to some people, you'd never have Wi-Fi in your house. Why? Because, well, it's, it ain't natural. I know, but I need it. How could I have a podcast without Wi-Fi? My wife, she loves her smartwatch. I don't like smartwatches for me. Why? It's not because I'm worried about the EMF or anything like that. I'm not. I'm more worried about, I'm going to see every stinking email. I get 1,000 emails a day. I don't want my phone telling me that. Or my watch telling me. My phone tells me, I don't need my watch to tell me too. To me, it's a distraction. I like my old-fashioned watch, okay? Anyway, but all I say is the overarching principle of everything that I'm saying right here about this. Keep your liver clean. Your liver is your detox organ. It knows how to get rid of garbage in your body. Keep it clean. You need to keep it clean. Keep your liver clean. Keep your kidneys flowing. H2O. Water. Thank you. Rita, we appreciate you. Kate, I heard nattokinase, see? See, nattokinase. Can reduce blood pressure. Is that true? Wouldn't be my first choice. Yeah, like I told you, it acts like a blood thinner. It thins out your platelets. It's the only thing I can, maybe vitamin E a little bit. The other vitamin E, not exercise. Does it really thin your blood out? Does it really thin your platelets out? Nattokinase, yeah. So with a blood thinner, I would tell you probably to be a little bit careful. Blood pressure, I like omega-3. I like Navital better than nattokinase. Let's see if we can get done here. I think I can. Mario, what causes osteoarthritis? Well, lots of things. Injuries, aging. Okay? Probably the most common cause is wear and tear and bobos. You hurt yourself. Hurt your knee years ago and you get an x-ray and you got some degeneration in there. The spine degenerates, osteoarthritis. It's not like rheumatoid arthritis, which is an autoimmune disease, the body attacking the joints. They're turning on their own joints. It's different. Osteoarthritis, I love curcumin. I love Navital. I love vitamin D. All anti-inflammatory. Regenerate the joint to some extent. Keep moving as much as you can. Use it or lose it. Love you. Vitamin D with K2, by the way. Take the calcium out of there. Kathy. Hi, Kath. Why? This is a good question, Kathy. I'm glad you asked it, okay? Because you're asking, she says, okay, Dr. Martin, I caught you. I love it. You guys are the best. Dr. Martin, you always tell us don't take calcium as a supplement. And why do you have calcium citrate in your blood boost? It used to be called that. Okay? There was a reason I called it that. And until Health Canada said, we can't call it that anymore. Anyway, I don't want to get excited. It's called the multi-nutrient now. My son and I designed that formula. And I mean, you will never, ever find a formula like that. Our multi-nutrient, formerly called Blood Boost. Because I saw so many, especially young women, who lived, who were vegetarian or vegan, or very, very little meat, very little eggs, meat, and cheese, because they were eating low fat, and they didn't, and I used to grab their little face, and I go, Can I convince you to eat meat? You're anemic. You look like Casper the Ghost. Plus you got heavy menses or whatever, and they were anemic, and they were low in B12, and they were low in vitamin D, and they were low. And I knew what to do, because they wouldn't. I'd say, I want you to eat differently. That wasn't easy to convince, especially young girls, but it wasn't only young girls. I saw a lot of women mostly come in that were borderline anemic and nothing was working. They said, well, you need my blood boost. Tens of thousands of people. And here's another thing that I saw. They had malabsorption. They weren't absorbing. How did I know that? Because some of them were eating, but they weren't absorbing. Their stomach acidity. They weren't getting the amino acids they needed because their stomach is. We talked about that this week. And the use of PPIs. I saw a lot of that. So what I did is I would want to give them it's not a multivitamin. Okay, multivitamin. Okay, you want to take a multivitamin? I don't care. Take it. But this is a multi-nutrient. I put everything in. It was like eating an egg. Do you got calcium in an egg? Yes, you do. You got lots of it. With vitamin K2, of course. So these people either weren't eating it or they weren't absorbing it. And I had their blood work. I could prove it. And I said, you need to be on my blood boost or multi-nutrient. There's nothing like it in the world. You take a big tablespoon of it a day and watch the difference in your life. Because now you're going to get all the amino acids right into your bloodstream, and you need calcium. I want you to eat your calcium. I do. Am I against calcium? No, I want you to eat it. So this was eating it. Okay? It really wasn't just you're taking a supplement of calcium. Okay? It wasn't. It was I wanted everything. Every amino acid. I put in every protein that you needed it. So when I liquefied that and put it in the liquid, they're getting the nutrition they weren't getting. So I am so happy, Kathy, that you asked me. Because you see, I went on a rant, and I'm glad you asked the question. Okay? That was Kathy. And you've been advised not to take calcium supplement. You're right. Just don't take the calcium. You're eating good. You're getting all the calcium you need with vitamin K2. That's what I mean. It was these people. Okay? I think I explained it. Okay? Joan, systemic sclerosis. Okay, that's an autoimmune again, and sclerosis, and this very serious condition, especially not only on your joints, connective tissue and collagen, but that can happen on the organs too, and they become sclerotic, very dangerous. Always starts, in my opinion, with autoimmune is leaky gut. Body turning on itself. Probiotics, big time. Stay off all sugar, because you got a fungus in there, I guarantee it. Don't feed the bears. That's what I would do. Vitamin D, high DHA. Joanne, what do you think about a balanced bioidentical hormones? I like bioidentical. I was a bioidentical hormone doctor. I liked them. I never gave estrogen though. Ask my patients. You didn't get estrogen in my clinic. I didn't believe in it. And I understand why doctors do it, because they're not thinking of xenoestrogens. We're surrounded by that in the world big time. Women don't need more estrogen. They need more progesterone. Okay? So our menopausal formula elevates progesterone and dims out the bad extra estrogens. Okay? But I like bioidentical. I just tell you, be careful, don't take estrogen. You don't need it. Okay, Shelley's asking a good question. How do I know if I am metabolically healed? For example, if you do the reset 30 days, you'll notice a huge difference in your metabolic healing. And how do I know that? Well, not just by the way you feel, by your blood work. Okay? So what is metabolic syndrome characterized? High blood pressure, elevated blood sugar, A1C, slightly or high, but so you can measure that. Blood pressure, blood sugar. A1C is the test I like the best. Okay? Check your triglycerides. Check your HDL. Check your uric acid. Look for belly fat. All those things are, and vitamin D and B12. I add those. I've added 3 biomarkers for metabolic syndrome. Okay? Vitamin D. What are your numbers? B12 and uric acid. Because if you have elevated insulin resistance, your uric acid is going to go up. Almost invariably. Okay? So that's how you know. You get numbers before and after, and you'll see the difference. It's unbelievable. I used to prove it to people. Here's your before blood work. Look at your numbers, triglyceride, blah, 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 blah. They're all out of whack. And now, look at how it's come down. Tens of thousands of patients over the years. That's why I wrote the book on the metabolic reset. That's why I wrote Sun, Steak, and Steel in Sleep. Metabolic reset is in there. I talk about it. How to fix it. Thank you. And that was Taminetla. That was Shelley. Shelley, I love you. Deed. Hi, Deed. Is seaweed good for you? Kelp. Yeah, I guess so. The Japanese eat a lot of seaweed, right? Don't they? Yeah. Look, the problem with seaweed, there may be a lot of heavy metal in there. You know what? You can have some seaweed. Don't live on it. Okay? It's got iodine. I like that. It's got iron, but it doesn't have the right type of iron. Seaweed, steak. What's it better? Steak, and it ain't even close. Seaweed or an egg? What's better? An egg, and it ain't even close. Seaweed or cheese, dairy, butter? What's better? Butter, dairy, and it ain't even close. But seaweed. Don't they give you seaweed, in Chinese food? They add that. When I went to China, okay? I gave seminars there in China, I don't know how many years ago. In the early 2000s, anyway. I can't even remember now. When I went to China. And they eat a lot of seaweed there. Okay? But they don't live on that. They live on fish. Okay. When I went to China, I asked them do you got any Canadian Chinese food? They didn't. Do you have any chicken fried rice? Kind of laughed, okay? Because they're looking at me like, what? That's not Chinese food. I said, in Canada it is. Anyway. Okay, Kathy, and this is the last one, okay? Then we're done. I have a 16-year-old granddaughter. Do I? No, I got a 16-year-old grandson. But I got 4 granddaughters, and they were 116. Okay? Isn't that a song? No, it's 17. She was just 17. Do you remember that one? I think that was a Beatles song. Anyway, let's quit singing. I have a 16-year-old granddaughter, and she's been diagnosed with PCOS, polycystic ovarian disorder. Okay? Have I seen that? Never heard of it. How about 1,000 times? You know what's happening? Too much estrogen and not enough progesterone. Too much insulin. That's why in PCOS, a doctor will give them metformin. I don't like that. I would rather they change their diet. Get off the carbs, get off the sugars. I put them on probiotics, and I dimmed out their, I had them on flax seeds to dim out their estrogen. And I had them on, I even put them on the menopausal formula, even though they weren't in menopause. Because it dims, it's got dim in it. That's what you do. It's amazing. Change the diet. If they'll do it. The problem with 16-year-old granddaughters, they don't always listen, Lindas. Then they should. And I used to grab their little faces too. And say, listen, we can fix. And your skin, where you got lots of acne, we're going to put you on, we're going to lower your estrogen, we're going to lower your insulin, and we're going to fix up your leaky gut. And you're going to get better. You watch and see. Amazing how much better they got. Okay? Okay, guys, I'm done. I ranted a lot today, didn't I? I was having fun. I'm breathing. I'm breathing. Okay. Monday is Thanksgiving in Canada. Okay. In my American friends have their Thanksgiving in November, but in Canada, we have it on Monday. And guess what? I'm going to be on anyway. Okay. So if you're up 8:30 live in the morning on Monday, I'm on. Lord willing. I always have to say that. Okay? Love you guys. Talk to you soon.